Echinococcus granulosus. These are hydatid cysts. So how do these present? And they tend to affect the liver and the lungs. So the hydatid cyst is due to this parasite, the Echinococcus granulosus. So Echinococcus, or this parasitic disease of tapeworms, infects humans through dog feces. So via ingestion of food which contains those parasitic eggs, or contaminated with dog feces, since the dogs are the obligatory host, the definitive host, not the obligatory but the definitive host for these cysts and for these parasites. How does the hydatid cyst present to the liver? In the liver, it presents as an eggshell calcification. And remember, the most serious complication is a cyst rupture. The cyst rupture can cause anaphylaxis, and it often tends to cause damage by a type 1 hypersensitivity response. And like I said, the route of transmission is by ingesting these eggs which contain dog feces. Sheep are the intermediate host. So here's a diagram of the cystic echinococcus parasitic disease. This causes a cystic disease, a cystic parasitic infection within the host. Now these cysts appear as ring calcifications on CT. These cysts can form within the liver or within the lungs, and as they form within the liver, they calcify. And the most important thing we're trying to prevent with our surgical excision or our surgical cystectomy as we excise this cyst is we're trying to prevent rupture of the cyst. Rupture of the cyst would result in anaphylaxis or type 1 hypersensitivity response. Keep in mind, if the cyst ruptures while it's within the liver, this is going to cause that typical liver response. It's going to cause jaundice, urticaria, hepatomegaly, and it's going to cause those anyway. But the important thing to remember about the rupture, let me just tell you, the morbidity of the rupture, so there could be a biliary rupture. Let me just make it clear. There could be a biliary rupture or there could be a cystic rupture. So if it's just the cyst that ruptures, that's going to be different versus if the biliary rupture occurs too. So if it's just the cyst that ruptures, that is the one that's going to cause that anaphylaxis and your type 1 hypersensitivity response. But if it's the biliary tree, if it's the entire biliary rupture, that is what will cause infection and, that is what will cause the triad of biliary colic. I'll just be very clear. It will cause foremost a biliary colic, jaundice, and urticaria, which is diffuse itching. Okay, so what increases morbidity in these patients with a cystic echinococcus? I can't pronounce it. So what increases the morbidity? So the morbidity is higher via either the cyst rupturing, which we've already talked about, how it's a poor prognostic factor, or with some sort of preceding or following infection, and if there is some sort of obstruction of the biliary tree, or the bronchial obstruction. So the morbidity can be increased by a biliary obstruction, or the obstruction in the liver, or a bronchial obstruction. Because one of the complications of the cystic lesions in the lung are a pleural effusion. Okay, so a lot of these cysts are asymptomatic, okay? So can a patient not show any signs? Yes, they can. Yes, patients may remain asymptomatic for many years since the cysts grow slowly. In what case will they be immediately, or at what point does the patient become symptomatic? So the patient may become symptomatic if the cyst increases in size to greater than, that's not the greater sign, greater than 5 centimeters. That is pretty big in diameter. So just to recap, by the way, the dog was the definitive host and the intermediate host was the sheep. And the human became an accidental host by ingesting these dog feces. If the eggs of this parasite, the larvae, egg for larva, this egg is transmitted in the dog feces, and then upon ingestion, the human becomes the host of these eggs, these larvae. But guess what? Only the eggs remain. The tapeworm itself does not get transmitted from the human. So this looks like terrible handwriting. So what is echinococcal infection? It's a tapeworm parasitic infection. Which organ system does it affect? It infects the liver. In the liver, it will cause hepatomegaly, jaundice, and abdominal pain. In the lungs, it will cause chest pain, dyspnea, and cough. How do you diagnose it? Well, you can see the cysts upon ultrasound. Ultrasound is actually the first line. CT is the one that if you want to clarify or if you want to do a differential diagnosis with an amoebic cyst or a pyogenic cyst. That is the differential diagnosis with a CT scan. CT scan will show these calcifications. There is also one other type of echinococcal infection called the alveolar one, but that is a zoonotic parasitic differential. How will we treat this is also known as a Hydatid cyst? So how will we treat a Hydatid cyst of the lung? So you want to do a surgical excision or a cystectomy. Do a surgery. So there's two things we want to keep in mind when we do a surgical excision of this cyst, which is to ensure that the cyst does not rupture, because that will cause a diffuse anaphylaxis. And the other thing to remember is you have to sterilize the contents first of the biliary structures, the liver or the lung. And what must you do before the surgical excision? You must puncture. You must puncture the cyst. You must, this was for this question. And what about, this is a mnemonic to summarize the entire procedure. So you puncture, you aspirate, you inject saline, and then you re-aspirate. So puncture the cyst, aspirate out the fluid, inject saline, and re-aspirate. Extreme caution must be taken because we do not want a rupture to exceed the peritoneal cavity. Also, the important thing is that the cyst is partially aspirated and then it's again aspirated. Once it's aspirated again, it also becomes refilled in between it becomes refilled with hypertonic saline. This hypertonic saline is important because it's scolicidal. It's a scolicidal agent, if that's how you say it. So SCOLICIDAL, scolicidal, which means it can kill and destroy these parasites. Are there any post-operative medicines? Yeah, you can give mebendazole. post-operatively. Thanks a lot. See you in the next